Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well. I'm going to go through this case. This is a really great gentleman. He came in the other day really looking amazing. His skin's looking awesome. I want to show just the progress that we've had for this patient. I showed earlier this patient about a month or so ago, and you can see just the continued improvement of his skin. Take a look at this, the skin quality, the texture. It looks awesome. It looks amazing. So I'm going to walk you through this whole process here because this is a really cool case. Hopefully everybody could hear me okay. And we'll go through how I got this because this is one of those cases where somebody who is Fitzpatrick V actually with hyperpigmentation already, and really a lot of people would have said that there's just nothing you could do with these kind of scars. He's somebody who had done treatments before in the past. Nothing really seemed to work. And the reason why is because they just use lasers and energy devices, and that's not going to help really for these kind of scars. Sorry, not by itself, I should say. And then he also did a bunch of microneedling, and that wasn't going to help. What we really needed to do was just to undermine the skin with subcision. We need to break up that scar tissue really well. And then what also we had to do is actually give him some volume again. We did have to do some collagen stimulating products, so we used Sculptra and Bellafill for this patient, which worked out really well for him. And then we also did some TCA Cross for those boxcar scars as well. Oh, I'm up and saying, what's up, Dr. Qazi? It was awesome seeing you on Friday. Sorry for not talking as much due to the numbing cream. That's all right. I appreciate you. Thanks so much for coming on. And I look forward to seeing the whole progress over here for you. And I don't remember you letting us share your results or not, but it's going to be awesome ultimately. Hi, Mrs. Jones. Good seeing you on. Thanks so much for coming on too. And good seeing you guys. Stacy, good seeing you on today too. And everybody else that's one of my regular patients here. Gabe is saying, how many laser treatments does it take to plateau on scars? Well, Gabe, your skin looks really good already. But I don't know if there's really truly a plateau, because I do think that it's, as long as you're spacing it out okay, as long as patients are okay with the just following the instructions and staying away from the sun, you really can continue to get better and better results. Like I continue to get better results every time I touch it in my own skin. So it's just like, I know that that's the way it is for our patients too. Are you taking new patients? Yeah, currently we still are taking new patients. We have made it so that we're focusing on a lot of our existing patients, that we can make sure that they can come on time. There's a whole process where we really want to make sure that our regular patients, our day-to-day patients who've done steps before, we have room for them. So we do have, we do still see new patients, but our priority is always really now at this point going forward, I should say, is going to be with our existing patients, so that we could put them in on time. I heard a lot of feedback from patients saying that they were having a hard time getting in. And that's the thing. I want to make sure that we could get that for them. How do you feel about fibroblasting? I don't like it at all. I hope nobody recommended that to you, because that's not something that I would recommend. Fibroblasting is not something that I would recommend really for for acne, for scars. Really not going to help too much really for that. If you guys could do me a favor and share the live for me, because it looks like they're kind of blocking things a little bit for some reason, so it'll be helpful. But I'm not sure what happened there, but sometimes they periodically just put me on a little bit of a ban there sometimes. So if you could share it or like it, it'd be really helpful, because occasionally that ends up happening. It looks like that's what's going on right now. Apple user 57 is saying, hi doctor, what would you recommend would you recommend Trifarotene for the face, because adapalene hasn't been working after 2 years using? That's fine. I think that a lot of times the antimicrobial component, or you should have something for antimicrobial. So sometimes you may have to consider something like a topical sulfur-based cream or potentially like Clindamycin. All those could be options there, but you may have to see if there's something else that's causing the breakouts. It may not be that you just have to go escalate with the retinoid. I'm assuming you're talking about for acne purposes. If it's just for like anti-aging purposes, that's different. But for acne purposes, you may want to add some other components there. Let's see here. Where was I at? I'm going to catch up over here. Let's see. How long after procedure can you still go back to being in the sun and getting a tan? Never. You should never be in a tan. That's like never something you should be doing. It always is something that's always going to be damaging your tissue. I would never recommend that. So don't recommend doing any tanning whatsoever, because really it's going to actually make it seem like especially if you have some hyperpigmentation, what can end up happening is that you can see that the scars look a little bit deeper than because of that hyperpigmentation. So I would not recommend that. But you will be more sun sensitive. There's no question about that. And that could be 3 months or so at least, depending on your skin type. It could be about 3 months or so. And just be careful with the sun going forward, though. It's definitely tanning, not something I would recommend even a little bit there. Resin, good seeing you on. Thank you so much for the follow-up too that we had. Resin saying, hi doctor, hope all was well. Have you heard of microcurrent muscle stimulation for the face? Is it good? There's actually a patient of mine. She was saying that she had done something which was like M-Face, I believe it was. There's a few different brands out there. She said it did seem to help out with her. She found that it was like a little bit of a tightening effect there. I don't know if it's necessarily worth the cost for it per se for a lot of patients, but you are maybe somebody that would be helpful for, and it probably wouldn't hurt you. Let's see here. Crystal saying, I've been on Proactiv for 20 years. Every time I quit, my skin freaks. Any recommendations on how to quit it? Wow, Proactiv. I didn't even realize that they're still around, actually. I actually did not realize that. The thing is that what you're probably liking is that topical benzoyl peroxide, and you may need to do something that's like an alternative, like a sulfur-based medication. And so you can actually just use like a sulfur skin wash, a sulfur-based skin wash. Actually, Paula's Choice has one. Consider using that. It's not a bad option. And then you may want like some sort of like exfoliant. And so you could use something like a glycolic acid. So a physical exfoliant like glycolic acid once a week will work really well. And then the rest of the week, actually just do like a low dose retinoid, and just over the counter is different. Just use that, just different cream over the counter, and do a lot with moisturizing now too. Alexander is saying, I had a really bad breakout and it stopped, and I'm not breaking out anymore, but still have a red spot. So what you're talking about is something called post-inflammatory erythema, PIE, really common in a lot of patients. What we want to do is usually do things that are going to help with the sensitivity over there to prevent so that you don't get hyperpigmentation, like post-inflammatory hyperpigmentation, where it gets darker. So make sure you're using sunblock. And then on top of it, you could do like low dose azelaic acid, just 10% azelaic acid should actually help out. But if you need to, we may have to use a laser to clear it up. It could take a couple sessions to clear it up depending on that. Secret Society is saying, you really put in the work. Thank you for giving out free tips to the world. Yeah, absolutely. I love it, actually. I like things that are open source like that too. So I love it. Period is saying, the image on the green screen, what is the process and how much does it cost on average? So we did a few steps over here. We did let me actually just see if I could blow up this image a bit more for you. So what we ended up doing was we did TCA Cross for those boxcar scars. We also did some subcision. We did laser. In this case, I actually did do ablative CO2 laser. I did, I forgot to mention, but the subcision I did was called Taylor Liberator subcision in this case, as well as Microneedling subcision. And then we also did some Sculptra and Radiesse for this patient. Sculptra and Bellafill for this patient. So incredible improvement. It's going to get better and better actually over time. And, this is one of these things. Actually, if you look at it, I'll try to make it so that this is really enlarged here actually so you can see it better. Let's see if I can try to get this a little bit bigger for you. But you can see actually just that skin quality has improved a ton. Look at that. Like that is really, really excellent skin contraction and improvement. And it wasn't visible like this kind of improvement within the first month or so. It wasn't really, it was over time that got better and better. So this is something really cool. You can see, just look at that skin. It just looks amazing. Sharon is saying, has decreased sensation on the cheek on one side, is thicker skin than the other after Taylor Liberator subcision. It's been a year and no change. What can I do so my face doesn't look saggy? Are you saying, Sharon, that you got Taylor Liberator and it's sagging, and you also have noticed that there's decreased sensation? I'm a little confused about the question there. Let's see here. Wafa saying, I've done 2 sessions of Subcision CO2 laser TCA Cross in November and December, but I still see no improvement. Do you suggest more sessions? Well, Wafa, I don't think that you're one of my patients, but typically there's a volume that needs to be replaced. So if you need volume, that's something that you likely are going to need to do sooner, because you probably aren't going to see that kind of improvement until you get that volume. We got this kind of improvement also because of volume replacement. So if he is asking how do you determine whether you use Sculptra or Bellafill? In this case, there was a lot of fat destruction, a ton of it. So I ended up using I used Sculptra for the patient for a lot of that volume loss. And then I also, just for like those select areas that we had, like really those areas where I wanted just to kind of like give a little bit more like really some support there, especially as you get older. I want to make sure there's something always underneath there. Then I put a little bit of Bellafill there to just support those areas. Sometimes I do it the same day. Sometimes I spread it out. In this case, I actually did spread it out, where I first did some Sculptra, and then about a month later, I did a little bit of Bellafill. So a few steps there. Let's see here. Someone's asking about V-beam. Yes, I don't use it myself, but what is the particular question that you're asking about with V-beam? And then I can be able to answer and see if that's something that I can answer. Because I actually don't have the device right now, but I'm familiar with it. I use XLV, which works very similar. It just has less of the rebound pigmentation that can occur with darker skin types. Let's see here. Nafisa saying, I joined the live late. What treatments were done on this patient? Well, a few different steps. We did telomeres liberator subcision in this case. We did TCA Cross in this case. We did some volume replacement in this case as well. And then we did ablative CO2 laser around the edges of the kit as well. So a few different things over here. Is Luminous CO2 the best? No, it's not the best. I use it, but it's not the best. So there's a lot of different devices out there. I think that it's about the way we do it, the way that we focus our energy and our heat. You could use almost any CO2 laser as long as it has the right hand pieces, really. And so, it's not about the particular device. Personally, actually, I told them before about this, but there's it's like ergonomically, I don't really love it. And then there's a lot of times, like if I shift it a bit, there'll be like an error or something like that. So, there's probably better devices out there, to be honest with you. It's just, I happen to like this because it's like, it works really well for me. Like, it's like a really nice, precise tool, but there's, multiple different CO2 lasers. And I wouldn't really say that you should really go to somebody based on their CO2 laser. You just like see how they're doing, what kind of work they're doing, and how they're getting their results there. Do you recommend at-home microneedling devices or no? No, I don't recommend any of those pen ones at all. I don't think that they're great. I think that actually sometimes they could cause more pigmentation issues. People sometimes dig in too much and they could actually cause more scarring too. Do not recommend that really at all. So I would say that you should try to stay away from that and consider more things that are going to be longer lasting, more permanent solutions. Things like what we did over here, which is Subcision, TCA Cross, laser, and then we did some permanent volume where we placed some Bellafill in there. That's going to help out for a long, long time. So I would really recommend that. Munak is saying, is forehead area easy to treat rolling ice pick scars? Actually, I do think it is easier to treat, to be honest with you. I think temples and forehead are actually easier for me to treat, which is kind of interesting because a lot of people say that those are like the worst scars to treat, but I actually think it's the easiest. I think temple and forehead are actually pretty easy to treat, actually. A lot of times it doesn't take too much to be able to fix that up. So I do like it. Beef tallow, I'm using it right now, actually. I think it's working on my skin. I did get a couple breakouts though initially, but I'm using it actually. I'm liking it. I'm liking it a lot actually. So we'll give you an updated thing soon, which should be interesting because I may do something with it. Like I may figure out something with that because I like for pre-treatment purposes, stuff like that. I just got to make sure for more acne prone skin, it's not going to cause too many problems, but it may end up being a really good solution for a lot of patients. Actually, I think that there's a lot of vitamin A in there. At least that's what it feels like. It feels like it's like just like a retinoid on my face. And, I'm going to break it down and see exactly what all the composition of it is. But I'm trying different kinds to see. But to be honest with you, I do think it's good. I like it. I've been liking it actually. And I was skeptical that, I just say this whole thing is like open source here too. And like a lot of people were asking me about it for months and months and months. And I said, finally, I'm going to try it out. I'm going to try it. So I've been trying it now for, I think, 3 weeks or so now. And I like it. I like it a lot, actually. So there you go. There's my unbiased, unsponsored opinion right now that beef tallow is actually helping my skin. I like it. I do think that, yeah, with brand, there's absolutely no regulation, and that's the problem. I absolutely agree with you. So I'm going to be trying a bunch of different ways of doing it, though, actually. So to be honest with you, I have to just try out different stuff because I was like, I got to figure it out. One of the things that I've been looking at, though, is that I do think that there's been like a push by by a particular industry, and I was mad about it. Yeah, I was mad about beef tallow. I was mad about the way they were putting their affiliate links and everything, these Amazon affiliate links, and I just didn't believe the way they were saying that it's going to cure your scars and everything like that. I didn't like that. I didn't like the fact that they were making it seem like, oh, it's going to cure your scars and it's going to work on like all this other stuff. And it's going to, like, people were saying it solved their, their acne in like 3 days and stuff like that. And that's the stuff I didn't like. But I did like really just the way that, it's feeling my skin. It definitely is like it feels like a retinoid to me. That's what it feels like. It just feels like I've used tretinoin since I was 16 years old, and beef tallow just feels like that. So kind of interesting. Dr. Qazi, how long does it take for redness after a breakout to leave? A good question. I mean, if you use sunblock, use moisturizer, it really should just take a few weeks, really. It shouldn't be too long after that. Brianna is asking for help. Brianna, how could I help you? Would you just state your question? I'll be able to help you out there. Zachy is asking, are TCA peels good? Yes, they could be good in the right skin type. They could be in the right skin type. It just depends on what the skin type is and what kind of scars they are as well. But yes, they could be actually totally fine in the right skin type with somebody who's comfortable doing TCA peels. Not too many people are comfortable with it. Oh, Veronica's on here. Veronica's saying, hi, doctor. Just got my rhinophyma treatment today. Awesome, Veronica. Thank you so much for coming on. And I know Veronica was actually suffering from rosacea on the nose. And what ended up happening with rosacea is that it caused the skin to get very, very thick, actually. And the thickness looks really like it's like the nose is just growing and growing and growing. People just think that their nose is growing as they're getting older, but what it really was is localized rosacea, and that rosacea actually really needs to be managed. So what we did was for Veronica was we controlled her rosacea a lot. She said that her rosacea is a lot better controlled. And then we ended up doing something where we did fully ablative CO2 laser right now today, and I smoothed out the nose that way. Evelyn, good seeing you on. Evelyn's always comes on, and she's one of our patients. She does melasma. Her skin's looking amazing. Actually, I also worked on her for her jaw area, and she lets us share her results, which I really appreciate. So how is it going, Evelyn? Good seeing you on. Thank you for coming on. David is saying, how do you get rid of scars like the ones on the screen? So this is more with manual work, going in there, breaking up that scar tissue, breaking up the scar tissue really well with Subcision. That's what worked out for this patient. That's what we had to do. The only way to really solve this is that, actually. So do that, and then plus we did some volume replacement, did some CO2 laser, and then TCA Cross as well. So it took a few different steps, but that's how we did it. Nafisa is saying, for your patients who fly out, do you structure treatments differently than local patients? Sometimes, yeah, depending if you're able to give me a little more downtime if you're flying out. I'm trying to maximize your visits, and we could do it. We could definitely do it that way. Just let me know what how much downtime you have and what your risk tolerance is. If you want me to push it a bit, let me know. If you're okay with a little bit of hyperpigmentation for a period of time, it gets cleared up, but we may have to, have a real discussion about that. And we do so many patients. Most of our patients are out of state, actually. Most of our patients. So we absolutely could do this very, very well at a very, very high level over and over and over again. Let's see here. Marie is saying, my son has scars on his face from acne he used to have. What do you recommend? It depends on the level of the scars, how deep the scars are. If it's something that's more just like, mild scarring, then maybe just controlling the oil production, sometimes that can help shrink it. But if it is something that's more like this kind of case, or if it's like you're looking at these deep ice pick scars, boxcar scars, we may have to do more treatments, things like TCA Cross. We may have to do excisions. We may have to do laser resurfacing. There's a few different things that we may have to do actually for those kind of scars. So it depends on really what kind of scars your son has. But I'm thinking, it's really nice that he has you as a mother that's caring about this. Not everybody knows about this, and not everybody wants to look into this. But it's awesome. I think a lot of people now are looking at this and realizing that this affects people in so many different ways, and they don't want people to suffer from that, which is awesome. I don't see a price for Subcision on your website. Do you have a rough estimate for the cost? Yeah, it's most treatments are about 800 to up to 2,000 for Subcision, but that's usually when it's more complex or so. And sometimes if there's excisions, it could take a little bit more, but that's typically. Let's see here. I'll appreciate you, Evelyn, saying you are the best in this world, which I appreciate you. I appreciate you so much. Evelyn's transformation is amazing. Actually, you guys should actually take a look at her page. She does showcase a lot of stuff on there, just in terms of just like her pigmentation improving, then also just like what we did for microlipo and tightening her skin. So it's awesome. And she's somebody who follows exactly what I say, and her results just are amazing. SB is saying, if another derm doctor recommended Sculptra, can we just buy it on your website without having a consultation? Sure, yeah. I mean, you could do that. People buy that, and then it's okay. Usually, like, there's a place where you could put Sculptra in there, so it's okay. So I wouldn't mind. You could definitely purchase Sculptra, and we could take a look and see. Munak is saying, can't wait to come to you. You're such an amazing doctor. I appreciate you, Munak. Thank you so much for the kind words. Really do. Thank you so much. Let's see here. I missed somebody's question here. Brianna just seeing, please help, but Brianna, you haven't asked, you haven't stated what the question was though. Okay, so I have Anna is saying, I have hyperpigmentation, some melasma, large pores, did a halo laser with minimal results. Yeah, actually it's kind of interesting. One time I had somebody who was pitching halo and wanted us to buy halo. And they were like, halo is the gold standard for melasma. I don't know what they were talking about. And they were like, oh, it's like killer for, I don't know what this gold standard meant either. Like, I don't know what they were referring to. There's way too much heat. There's way too much heat for melasma. Could it help for some people? Maybe, but it's not going to help enough for, a lot of patients, and especially with certain skin type. So I would not recommend it for melasma patients. There's a lot better options. It may not even need lasers. I'm not sure. Maybe it needs topical creams. It may need strong sunblock. But let's take a look. We'll do a consultation. We can see exactly what's happening for your pigmentation. But yeah, halo unfortunately was not the best option there. And Brianna, you may have just been like auto-filtered because you were asking so many times. So just feel free to just ask me again. But maybe rephrase it though, so that way it doesn't get auto-filtered. Liam is saying, what do you recommend for a hyperpigmentation and closed comedones? That's a good question because a lot of times closed comedones are due to oil production. Hyperpigmentation, I'm assuming you mean like darker pigmentation, like brown pigmentation. That's a little bit of a different type of process, but sometimes what we need to do is control that oil production, and we could do like a topical retinoid. You could just pick up different cream. Different works really well for that. Just start with that, and then if you want to help a little bit more with the pigmentation, especially if it's like darker pigmentation, you could use Eucerin's pigmentation cream. It works out pretty well, slow, but it could work. And then of course, if it's something that's stubborn, just talk to us, and we could help you out there. We could absolutely help you out though. Letty's asking, oh my God, I'm 26 and my cheeks look similar. I would absolutely love to help you out, Letty. These kind of scars, actually, just by breaking up the scar tissue really effectively, doing some volume replacement, it could be really, really rewarding, actually. So, you may not even have to wait too long, just a few months, you'll start seeing a lot of improvement there. How often do I perform TCA Cross? Honestly, probably 3 to 5 times a day. 3 to 5 times a day, actually. It's pretty interesting, actually. I don't know anybody who does this much TCA Cross. It's like at some point we got to just like publish all the ways we do TCA Cross and everything like that. There's a lot of different stuff that's involved with TCA Cross. And it's just like when I have some time, I have a backlog of stuff I have to work on that, but I'm going to do that. But it's going to be cool. It's going to be really cool. We're going to showcase a lot of stuff with that. But I do so much with TCA Cross, and it's like a lot of times it's like patients are doing like not necessarily the first step, but like, they're coming because people need 4 to 6 sessions sometimes. And so I'll see them again and again for some of these deeper ice pick scars or boxcar scars. And that's all I'm doing, just that. But there's a way I do it, and it works really, really well. It doesn't mean like, it has to be a lot of downtime. It doesn't mean that it has to take me a lot of time. I could do it really precisely, really effectively, and it just works really, really well, exactly how I do it. Tyson's asking, how do you fix your skin like those in the pictures? A few steps, really. It's mostly manual type of treatments where we said go in there, break up the scar tissue, where we also want to actually do some volume replacement too after we do that subcision. Laser to help out with the thickness around the scars. TCA Cross for the deep ice pick scars. So all those are actually options there really for us, and that's what we ended up doing for this patient. Travel Vlog is saying a plastic surgeon doctor said Bellafill doesn't help acne scars at all. I think they probably should stay away from Bellafill if they think that. because it sounds like they're not too familiar with the product, and they should maybe be really comfortable and familiar before doing it. So I would really recommend them doing that actually before touching it. Moonak is saying, I have forehead scars that I'm very insecure about. Sometimes with forehead scars, what we have to do is go in there, break up the scar tissue. That works out really well. Subcision. Doing a little bit of volume replacement works out really, really well. So like hyaluronic acid, and then TCA Cross laser works really well. Those are things that work out really, really well. Nimra Beauty is saying, for volume replacement, we have to regularly do Sculptra then to maintain that volume. Probably, yeah, you probably do have to do it regularly, but there is a cumulative effect there. It does actually improve it, and then it doesn't tend to go down as much as it did before. I have patients, honestly, that I ended up doing in their butt, and like 6-7 years ago or so, and like they still have like, they still feel like there's volume in there. They still feel like that. Like the reason I mentioned the butt area, because it's an area where you're putting a lot of pressure on it all day long, and they still feel like there's great volume in there. Their skin quality is really, really great, which is really interesting, really, really interesting. So it's like, you know, it seems to last a little bit longer than people may expect. And, you know, if you're taking care of your skin, otherwise doing everything else right, it's probably going to be fine. Let's see, Med School Angel saying there, hi there, I'm an incoming resident physician conscious about my scars, was told no CO2 laser. And maybe we don't have to do CO2 laser. It's possible we don't have to do CO2 laser. Maybe the other options. What residency, by the way, are you going into? Roxa saying, does phenol peel help with deep boxcar scars in the temple? I would say yes, it would help with that, but you may not have to do it that way. You may not have to do that. So it depends. You know, it's not necessary for you to actually have to do it where, you know, you do something with temple scars with a phenol peel. Maybe it's like just volume replacement, TCA Cross, and that's all you have to do. Med School Angel saying Long Island Memorial and going into IM. That's awesome. Congratulations. That's going to be a really awesome journey for you. So I will be happy to help you with the scar portion too, as well. Let's see here. Where was I at? I saw a bunch of things. So Travel Vlog is saying that some plastic surgeon told her or him that that Bellafill goes around the scars, and they're correct. They are correct. What ends up happening with any filler, if you've not broken up the scar tissue, is it will go around it. That's why you have to break it up and do subcision first. So it's a good thing they did not do any product on you, because that could have ended up happening there. That could have been the problem there. Cookies and Cream is saying, hi, Dr. Qazi, just a question. Do you still aspirate? No, I don't think I'm not a believer in aspiration, really. I don't believe in it. I think that actually there's more risk involved with it, because you actually are placing a bit more negative pressure. And as you're putting that negative pressure, you could actually just shift your needle or put a little bit of too much pressure into the blood vessel right afterwards. Don't recommend it. Instead, it's about pressure. So meaning, don't put too much pressure. Don't have a heavy hand. Anybody who's been one of my patients and they've done filler with me knows I do not have a heavy hand. I'm very, very light, and I constantly move my needle or my cannula. So I don't really recommend it, actually. The aspiration stuff, there's nothing that really showcases that it really works out. I think there's more risk that's involved with it. Sensu saying, Doc, does PicoSure laser, is it good for deep scars, and can it help to reduce visibility? Okay, so does PicoSure laser help with deep scars, and can it help reduce the visibility? It does actually help a bit with the scars, not necessarily the deep scars, but some of the wider scars do contract a bit with PicoSure laser. There's different ways of doing it too. You could do it actually in a way that's a bit ablative also, which I wouldn't recommend for a vast majority of people to do it that way, but you could do it that way, and that could help some more with your scars. There's a question about whether it's going to improve visibility. Well, if there is pigmentation and the pigmentation makes the scars look deeper and worse, then yes, it could help for that purpose as well. But there's a lot of better options. You may not really go down that route or need to go down that route, because you may have to do something like TCA Cross for those ice pick or boxcar scars. You may have to do Subcision for those rolling scars, volume replacement. There's a few different options, really. It doesn't have to be actually that you have to do a laser or a pico laser. Awesome result. Wow. We'll Keep It Zen saying, and Keep It Zen is going to be doing she's going to be doing our phenol peel in a couple weeks. So thank you so much for coming on again. Appreciate you. Sharon Pizarro saying, hello, a year ago, I did talar liberator subcision. I've experienced persistent decreased sensation and spot on both my cheeks. I've experienced sagging. I was wondering what I could do. Sharon, if you could, I know you're not a patient of ours, but if you could message me about that, because I am trying to keep track of people who've been saying they've had complications with any subcisions. And if you could just message me and we could take a look and see, what happened there, and potentially add it for studies, really, so that people, people know how to do this. I know there's people out here that do the tear liberator much differently than I do, much differently. And, typically loss of sensation, it should come back, really. But I'm not sure. There's some people that I see the way they do it, and it may be something that's more permanent, especially a year out. It's, I'm not sure if there's any improvement at this point, but if there's no improvement, it may be something that if you touch that area, you may have lost that sensation. But hopefully it's not, extensive. It's not something that's that's too problematic for you. The way I do it is more localized. I go with a blunt cannula and then tailor liberator just for some spots. I don't do it more than that. Just like some areas that really need to, we'll break it up. Any patient who's done it with me, they know how I do it. They can feel it, that I broke up the scar tissue really effectively with blunt cannula. And I'm only doing it in certain areas if I really need to. So it's very, very precise. C. Garza is asking, how many TCA peels are necessary to compare it to a phenol peel result? So TCA peels, typically you got to be careful with going deeper. So you typically are not going to be going too deep with TCA. But let's say that you're somebody who's the right skin type and you have the right kind of scars and you want to remodel your tissue. You can go and do this, it's tough to say unless you see somebody, but you can do it several times over the course of, let's say, 2-3 years, and start remodeling some of that tissue actually with the TCA. It does trigger collagen. It's also really good for pigmentation, so which helps as well. But whether it's going to be equivalent to something that gives a really robust collagen response like a phenol peel is really questionable. I think the collagen response of TCA is not going to be as dramatic as something like a phenol, and it really is more of the fact that you could do the phenol and then expect that when you do this, that you get and you're going down potentially to the reticular dermis, and you could get a really robust collagen response in that single session. Very, very different than with what you could do with the TCA peel. You're unlikely, especially at the concentrations that are going to be considered safe for patients, really unlikely to be triggering enough of a collagen response. And so, I wouldn't really say that it's going to be enough. And the people that attempt to do it with scars, especially people that are doing it at a high enough level, they actually tend to combine that with a laser even that same session. So, not necessarily something I would really be pushing though. For a lot of patients, especially patients who are Fitzpatrick IV and above, really can get more complications than it's worth, especially since you won't be getting the same kind of result. And I'm going to wrap it up in just a minute here. I'll answer just maybe 1 or 2 more questions here just so you guys know. But I'll be back on tomorrow. Appreciate everybody's positive feedback for this patient. He's super thrilled, by the way. So he's super, super thrilled right here. Let's see here. I did a TCA peel 13% 3 weeks ago. It was my 3rd one. Can I do a Cosmelan peel tomorrow? I don't know. It depends on how your skin is. If it's really recovered, usually you do wait a few weeks really before you do that. But 3 weeks could be okay, especially 13% TCA. It could be okay. It's tough to say. Let's see. Why do dermatologists recommend microneedling if it doesn't work? It's a good question. It's just this, what they have. They consider it standard of care. It's been in the book for decades, and they'll just say this is the gold standard, this is the standard of care. That's all it comes down to, honestly. It's not like they believe it. I don't think so. I don't think really they believe in it, honestly. I really don't think so. Maybe for really mild cases, they may say that, but a lot of people would say that it's just they know it doesn't really work that well. And, they just say, oh, there's nothing you can do for scars. And this is what we tried. We tried it. We tried doing it. And then we give up. And it's maybe shouldn't have tried that. There's certain things I don't even do. I don't even bother trying it because it's just not in my world that I do. So it's I want to try to do some ineffective treatment, but apparently they're comfortable doing that. Is Cosmelan safe for melasma? It depends on how it's being done. We at our practice, we're actually the only practice that ends up doing it with essentially a pharmacy, that we're allowed to do it with a pharmacy, and so we can make it actually a little bit of a stronger concentration there. So it depends. It depends on how they're doing it for the melasma. Some people they do find that the practice they went to may not have been actually sourced right correctly, because it's actually a peel that they've for some weird reason Amazon sells, and it's like a fake one. If you look at all the reviews, it's fake, and Amazon just refuses to take it down. Actually, I think they enjoy the fact that there's fake stuff on there, really. So and doctors may not know, but the place that they're getting it from may be somewhere that's not sourced appropriately. SB is saying, aside from tretinoin, what other treatment, how often do you do? How many doctors work in your clinic? Well, I'm confused by what besides tretinoin. Well, actually, right now I'm using beef tallow, actually, which is has vitamin A, but I'm using that with moisturizer and sunblock. And then how many doctors work in our clinic? I have one plastic surgeon, and then I have a dermatologist who also works over here too to see some patients as well. TX is saying, for cystic acne with very oily skin, do you recommend adapalene or retin-A? So if it's cystic acne, truly cystic acne with oily skin, you may want to escalate this. I mean, any topical retinoid is okay, but it's not going to be the complete solution. You may need oral medication like Accutane. You may need to do the laser that's just like Accutane called the Cure. A Cure laser works just like that. You may need to do something like that, and you'll probably need to do something like a topical antimicrobial medicine. So something like Dapsone, Clindamycin, all good options there. And SIB Insider, that's exactly what I was referring to. How do I stop oily skin? You could do that with something like oral, I just got a tongue tie, Accutane, or you could do something like the Cure laser. Those are all good options. You could also do topical creams like tretinoin. Depends on how oily it is. Depends on what's really happening with your skin. But I'll answer this final question here. Is it okay to do targeted phenol peel on only areas with really deep wrinkles? I would not recommend that. I think the pigmentation could really change dramatically. I think that you'll find that there could be a little bit more tissue contraction because of the phenol in certain locations like that. I would not say that that would be a good option to really do it that way. Instead, really blend it in everywhere. All right, guys, appreciate you so much. I will be back on